Welcome to the grand finale of our coverage of the Global Oral Cancer Forum. Hi, I'm Allie Cook. Today's April 27th, 2016, and this is your Wednesday Watch.
Now, oral cancer globally affects about 500,000 people, and of those, about 150,000 people die annually from oral cancer. We have been very fortunate to have an unrestricted educational grant from Henry Schein Cares Foundation, and that has allowed us to put together the program for the forum. And the purpose of the forum is not to solve the problems of oral cancer overnight, but more to expose all of the attendees to the different ideas, different programs that are going on around the world so that they can bring something back to their organization, to their workplace. This forum will bring in all of the stakeholders with an interest in oral cancer.
Here's today's dental news brought to you by the Henry Schein Cares Foundation. A study done in the United Kingdom indicates that bad teeth are a major reason why people would put off a second date. 67% of men and women surveyed admitted to this. The survey also revealed that 4% of people link straight teeth with intelligence, and 12% think a great smile demonstrates popularity. The celebrity with the greatest smile, according to respondents, was Duchess of Cambridge, Kate Middleton. As we wrap up our coverage of the Global Oral Cancer Forum, I'm proud to present an interview with Dr. Kerr. Dr. Kerr, chair of the organizing committee for this event, is a clinical professor at the NYU College of Dentistry and holds many other honors. Dr. Kerr and I discussed a variety of topics, including some history on the portraits of cancer survivors you've seen in the background in many of this month's interviews. Here's our conversation. Hi, it's now my pleasure to introduce you to Dr. Kerr, who's the organizer of this event. He also has some very interesting information about the portraits you see behind us, and we're going to get to that. But first, I want to congratulate you on such a wonderful event here today.
Thank you.
And can you tell us a little bit about how it got started?
Yes, well, Steve Kess from Henry Schein Cares Foundation came to me because we've had some other involvement on oral cancer related projects, and he said that Henry Schein Cares would like to get involved and help the cause. And so I thought that was a fantastic opportunity, and I engaged with my colleague from the UK, Professor Saman Warnakula-Surya, and it's been about 2 years of putting together the organizing committee, and I know we had a couple little false starts, a couple of delays in the date, but here we are, and I'm just absolutely thrilled.
That's wonderful. Well, congratulations once again. And tell us, we've been getting, one of the things people have really been talking about a lot here is these portraits. As they say, a picture's worth 1,000 words. You personally knew some of these patients, so what can you tell us?
So this is an interesting collaboration, and we again received some funding from Henry Schein Cares Foundation to do this photo project to really show the face of oral cancer. And so we started the project in India in August, and I went with photographers. I was there for 2 of the days that they were shooting, and we actually went into one of the busiest cancer hospitals in India, in Mumbai, Tata Memorial Hospital, and these are some of the patients. There are 2 patients, this one over here, and then the one right behind me. The other photos are actually from Guy's Hospital in London, where they did the second shoot, and we've just done a third shoot at NYU. And what I think is amazing about this is that every patient has an extraordinary journey and a story to tell. And I think that it's very powerful. Unfortunately, we haven't quite married the vignette about each patient to the photo. That's the next step. But I can tell you a little bit about this fellow. He came with his family from a great distance to the cancer hospital, and he actually had a free flap surgery to replace, part of his tongue. So that's why he has this little bit of skin between his lips. And but he was able to speak in a muffled way, but he just told his entire story. And what was interesting about him was that he felt that the cancer he didn't think it was related to the risk factors which he had been using. He thought it more related to his karma and the things that he had possibly done in his life. And so it's interesting, the concept of cancer in some, resource-poor countries where the education is so poor that cancer is not a recognizable and understood concept. But anyway, he was an amazing person. I'm looking forward to, presenting his little video one of these days.
Oh, well, thank you so much for giving us some insight. And this event has really taken off. I think we're really getting a lot of awareness. What do you see the next steps?
That's a very good question. And ask me that question again at the end of the conference. But I think right now, just based on the first two presentations, the first point is that we need to do better at capturing the information so we can understand the problem and the complexities of the problem. Only when you know the problem can you really address it head on. True. So we need to do better in that regard. And then the second session was really, focusing on the delays in diagnosis. And I think that many of the delays are at the level of the patient delays. And so we need to educate the public and get them in to see people who can evaluate their mouths. And unfortunately, it's not just the role of the dentist. The dentist can certainly play a more important role than they already are, but a lot of people don't even have access to the dentist. So we've got to focus on other ways of getting people into the hands of people who can examine them and then move them up through the chain of care into the higher care settings. So, how that's done and what really works is difficult to know. Many of these programs and awareness campaigns, it's not sure, how they really are working. Although I was very encouraged today to hear some of the interesting results coming from some of the campaigns around the world. So I think at the end, I think we're going to have a call to action, and it's going to be a well-considered, multi-pronged approach that we're going to have to sit down and digest everything that we've heard and come up with a plan. But the good news is that we've got all of these passionate individuals in the same room, and they come from many different facets. It's not just your academic and your clinician who are managing this disease, but it's, we've got organized dentistry here, we've got dental hygiene here, we've got industry, non-for-profit organizations, and other organizations, obviously the WHO and the international health agencies. So I think collectively we need to have everyone as part of the equation. And that's really it.
And having them here is a great start.
Yes, absolutely, without a doubt.
Well, thanks so much for talking to us today.
Yeah,
we appreciate it.
It's a pleasure.
And thank you for watching.
Okay, great.
Thanks, Dr. Kerr, and thank you for joining us for the Wednesday Watch. We hope this month has made an impact on your views and treatment of oral cancer.